Hi, Dr. Hagmeyer here. In my last video titled Anxiety, Is It Being Caused by Your Thyroid? We really talked about the role that the thyroid plays in anxiety and depression. We talked about the thyroid tests that you should have done. We also talked about how overconversion of T4 into T3 can lead to things like panic attacks, depression, anxiety, neurological problems. But that's not all there is to this picture of looking at how the thyroid is really connected to anxiety. And so if you have not seen that video, I'd really encourage you to go back and really view that. But since my last video, I've literally been flooded with questions from people all around the world asking about T3 and overconversion and what are the causes of it, and if I could talk a little bit more about it. So that's really part of what I want to do in today's video, as well as just unpack and unravel some of the different causes that you need to investigate for a natural approach to anxiety and depression. Now, too often the argument and battle that I see being waged by doctors and patients is really this T3 replacement battle. And here's the thing, folks, listen, I want you to realize, and I want you to know, is that the thyroid story goes far beyond taking T3 thyroid supplements, okay? It's so much more than Armour, it's so much more than just Cytomel, it's so much more than how much medication do I take, or what's the right medication. To really reverse and improve a thyroid problem, there's a lot of different things that need to be looked at. And I'm telling you this because I can speak from 15 years of experience. There are many different websites and thyroid forums, and from time to time I will jump on these forums, I'll answer questions, and from many people who are just literally desperate for answers. But the never-ending theme that I continue to hear about is either one that only looks at the T3 replacement model, or the other where the adrenals are the major cause. And so there is no doubt that both of these play a role, and I do want you to know that thyroid health is just bigger than these, okay? In my practice, I talk a lot about looking at the big picture, looking at all of the different pieces of a puzzle, so to speak, and how it relates to really getting to the root causes, okay? You need to look as many pieces of this thyroid, anxiety, depression puzzle as you possibly can. Now, the first step, if you suffer with anxiety or depression, is to really just get a proper thyroid evaluation, okay? Getting all the thyroid markers. Too often today, doctors really just run a TSH test and a T4. They rarely run antibodies. They rarely run T3. They rarely run free T3 and free T4 and reverse T3. And so these are all very, very important markers to really understand the different patterns of thyroid disease. Now, to really understand this, again, you have to have all the thyroid tests done. If needed, you may need an ultrasound. You may also need a biopsy of your thyroid, depending on the situation. But either way, the first step in identifying that overconversion problem is looking at that T4 to T3 conversion. Now, once you've identified the thyroid pattern, we need to ask, why is this person in this pattern in the first place? So circling this video back around and really how it relates to treating anxiety and depression naturally when overconversion of T4 to T3 is the problem, okay? We're going to need to understand 5 critical areas that influence the thyroid, influence blood sugar, influence gastrointestinal function. And so in today's video, where I want us to focus is going to be on those areas, these 5 areas. So before you lay down and just give up on life and let your doctor put you on a lot of different anti-anxiety medications like Xanax and Ativan and Ambien and Lunesta, or any other new medication that might be developed in the next couple years, I want you to know that if you address these 5 areas, there is just a tremendous possibility that you can completely reverse your anxiety and depression, and you can feel good, and you can do this without taking more medications. So let's talk a little bit about these additional connections to anxiety and depression and how they might be contributing to this thyroid pattern that might just be getting overlooked, okay? The first issue is the gut, okay? Number 1. Gastrointestinal function. Living inside your body, teeming inside your gastrointestinal tract are millions of bacteria. In fact, more than 50% of your fecal waste is bacteria. And these bacteria are just critical for brain function. They're critical for neurotransmitter production. They're critical for the synthesis of many different vitamins necessary for not only the immune system, but necessary for thyroid function, and absolutely necessary for the conversion of T4 into T3. But a common problem that I see often in people who have thyroid problems is a gastrointestinal infection where certain kinds of bacteria are producing toxins that can excite certain types of cells in your brain called the glial cells. And there's a lot of research behind these toxins. This is called an LPS, or lipopolysaccharide toxin. You can Google that in your Google browser and just type in LPS and depression. Now, these are people who really have no idea that they have this infection, and this is why we call this a hidden infection. Okay, now there's a special test that we run in our office that actually looks at this. Number 2 is inflammation. This is another huge problem related to depression and anxiety. It's connected to cardiovascular diseases, it's connected to diabetes, it's connected to thyroid problems, it's connected to irritable bowel syndrome, it's connected to cancer. Quite honestly, I don't know of any disease that doesn't involve some degree of inflammation, okay? Inflammation can come from a variety of places. It can come from certain food sensitivities. It can be caused by dysregulation or dysglycemia due to blood sugar. It can be a hormonal imbalance. It could be a gut barrier problem. Again, inflammation is a very necessary key to correcting these neurological problems that, again, include anxiety and depression. As you can see here, taking an antidepressant drug, taking an anti-anxiety medication is not going to correct inflammation, okay? Now, I recommend that you follow the Anti-Inflammatory Diet that's posted on my website. You can do a search on that. Type in Dr. Hagmeyer Anti-Inflammatory Diet, okay? This is a diet that I use for many autoimmune conditions, okay? It basically drives down inflammation. The other thing that I often use are things like turmeric and resveratrol. I use EPA, high quality EPA. I use proteolytic enzymes. I use probiotics. Again, all of these things are very, very important as it relates to addressing inflammation. Number 3 is blood sugar dysregulation, okay? How do you know you have a blood sugar problem? Well, real easy. How do you feel after you eat? Do you feel more tired? Do you feel more sluggish? Do you feel better if you skip meals? Do you experience sugar cravings? And so if you answered yes to any of these, you really need to join the Sugar Anonymous group, okay? You have a sugar problem, okay? You may not be a diabetic here, but you have a blood sugar problem, and this could be another contributing factor to anxiety and depression. I tell my patients one of the most important things your brain needs is it needs a steady source or a steady delivery of fuel. Anything that compromises oxygen delivery to the brain, which could be things like anemia, or anything else that compromises glucose into the cells, like hypoglycemia, insulin resistance, diabetes, what's going to happen is your brain is prematurely degenerating. It's prematurely aging, okay? Number 4 is related to the adrenals, okay? Here we're talking about the high cortisol connection to anxiety. I typically see high cortisol levels with anxiety, and I typically see low levels of cortisol more associated with things like depression. And I say usually, but studies show that not only does low cortisol cause problems with thyroid binding to the cell receptors, but we also see high cortisol levels affecting the way thyroid binds to its receptors as well. So the long story made short here is that high and low cortisol levels, adrenal problems, affect thyroid function and ultimately can explain emotional and behavioral symptoms even when a patient is on thyroid medications or if they've been told that their thyroid is normal. Now, my message to all of you who are watching this today is that even when you feel you're adequately being treated for your thyroid problem, don't be so quick to take another pill for a symptom related to anxiety or depression or sleep. I would strongly urge you to contact our office so that we can get you back on track, we can get the right testing done, and get you well. Now, the last component here is number 5, and this is food sensitivity. This is the connection that food sensitivity has with anxiety and depression. Now, one of the areas that research continues to point in is, as a culprit for neurological problems, is a specific food sensitivity called gluten. Okay, you can Google that again. Type in gluten sensitivity and depression, and again, gluten sensitivity and anxiety, gluten sensitivity and migraines. There's just so much research pointing to the dangers of gluten. So most people typically think that gluten only affects the gastrointestinal tract. But what we now know about gluten sensitivity is that the number 1 manifestation of a gluten sensitivity has absolutely nothing to do with the gastrointestinal tract. It's a neurological manifestation. You see, depending on your genes, the health of your intestinal barrier, and what it's been exposed to, gluten can really wreak havoc and cause damage to the brain. It can cause problems with the skin, causing eczema and psoriasis. And as most people already know, it can also cause problems with the gastrointestinal system. So if you experience anxiety, and you experience depression, and you experience brain fog, okay, or a loss of cognitive function, my recommendation is to ditch the grain. Okay, not only wheat grains, not only wheat gluten rather, but essentially virtually all grains. So in wrapping this video up, I want you to walk away with just a couple key points or really takeaways here. Number one, many causes to anxiety and depression are rooted either hormonally, in the gastrointestinal system, the adrenals, blood sugar problems, inflammation, and food sensitivities. Number two, if your doctor has not evaluated you for any of these areas, don't be so quick to accept an anti-anxiety medication as a Band-Aid. Rather what you should do, rather than focusing on the symptoms of anxiety and depression, what you really need to do is you need to stop and you need to ask, why am I feeling this anxiety? Why am I feeling depressed? And what other symptoms or systems of my body could be the cause, okay? Focus on getting your body healthy and not just eliminating these symptoms is going to be the key to correcting anxiety and depression using a natural approach. Well, I hope you enjoyed today's video. And remember, if you've been told that everything is normal or you feel that the doctors you've been seeing are not taking your anxiety, your panic attacks, your brain function serious, I want you to contact my office right now. If we're not in the office or it's after hours or you're out of state or you're out of the country, either way, leave us a message or leave me an email. Someone from my office will get back to you. They'll call you back as soon as we're back in the office. Don't live another day suffering and thinking that everything has been done. Please visit my website, drhagmeyer.com. There's a lot of other different videos and resources that we've put there for you so that you can help you just understand more about the confusing symptoms that you're experiencing. But most importantly, I want you to be able to get your life back, and I want you to do it naturally. Okay? So till next time, I'm Dr. Hagmeyer. Take care.